Hi, everyone. I'm Maggie McGrath, editor of ForbesWomen. Maven Clinic, a female-founded virtual care provider, has a big funding announcement today. And joining us now is the founder and CEO of Maven, Kate Ryder. Kate, thank you so much for joining us.
Thanks for having me.
So I teased a big announcement, but I want you to put it in your own words. Tell us, how much money has Maven raised and what does it mean for the company?
Sure. So we're thrilled to announce a $125 million fundraise, valuing us at about $1.7 billion. And, at a time when we've spent the last 10 years innovating in women's and family health with the more holistic virtual first model. But it feels like we're barely 5% of the way into our product roadmap. There's so much need and urgency, I think, to continue innovating in women's and family health. And so we're really excited to continue to put these funds to use for growth and innovation and just making a more patient-centered model of healthcare.
And this brings you to about $400 million in total funding raised since the inception of the company. Is that correct?
Yeah, a little over that, by about 425. Yeah.
I was looking at a Forbes story from 2018 where you had raised $42 million. A lot has changed from those early days, but can you talk about the evolution for the company and maybe just zoom back about why you founded Maven in the first place?
Sure. So back 10 years ago, I was living in London, and it was the decade at which I was going to have kids. I have 3 kids today, and a bunch of my very best friends were starting to have their first children. And it was pretty incredible to observe a lot of their journeys, whether it was a journey that had postpartum depression untreated in it, a journey where one of my friends couldn't afford fertility care and has a much smaller family as a result. And it was amazing to see that this healthcare system that a lot of innovation was starting to happen in was not really hitting women's and family health and some of these core journeys that are so deeply personal to women, to families, to parents. And so I thought, wow, we can take the best of digital health and the best of technology and really start to bend the system to better support the needs of the patients. And so that's what we did. We built the first ever telemedicine network just focused on women's and family health. We launched the first maternity benefit back, 8-9 years ago that really brought in postpartum care that focused on helping moms transition back into the workforce, that brought dads into the picture and provided pathways for them to help support their family as they were raising kids. And since then, we've expanded across the full spectrum of care that's needed in a lot of these different journeys. So starting with preconception and fertility care, through pregnancy, through parenting in those early years of supporting pediatrics. And then in 2022, we launched menopause as well. So it's been quite a journey, but still it feels like there's just so much more need. There's such diversity of need as well in a lot of the different populations navigating these journeys. We're global. We have about 10% of our membership global. So there's a lot of work left to do.
When you say preconception through menopause, that sounds like that covers a lot of a patient's journey, but you say you're only 5% of the way on the product roadmap. What does that mean, and what is next in terms of where you can go?
Well, I think that if you really take a larger step back, there's been some progress that we've seen over the last 10 years in women's and family health as it relates to access. I think I look at some of my friends who, if they were having kids today, 10 years later, like there would have been more access to maternal mental health care. Maven has that, has delivered on some of that access. There would have been more coverage for fertility. But I think when you look at access to care in this country, we've also taken enormous steps backward. When Roe v. Wade was overturned, there's now restricted access to care in a lot of different states that are making health outcomes worse for a lot of these families. In some cases, I think it's pretty devastating to see so many names in the news of maternal deaths that were avoidable. We're hearing a lot about some of those moms in Georgia. And so I think, the system has to get better and has to change and be more equitable for everyone. And so, one of the things that we're really proud of as a team is the fact that we have this holistic care model and that we've been able to prove that, even through virtual care in maternal health, you can reduce C-sections, you can reduce kind of admission into NICU, which means you've reduced, women delivering prematurely. You can develop a more kind of holistic approach to fertility care where you're helping people get pregnant naturally so they don't necessarily have to go into IVF. That support was not in the system a few years ago in a systemic way. And so, so that we're really proud of that. But I think at the end of the day, when you really look at what's wrong, in healthcare, you have a system where there's still misaligned incentives that's just desperately in need of payment model reform, where you are that every provider, every payer, every platform out there is super aligned to making a patient healthier and helping the patient get the right outcome. And so I think that one of the promises of digital health, and particularly in Maven in maternal health, is to be able to foster more trust on these digital platforms with this exceptional patient experience that is giving patients more of what they need, to be able to kind of prove that when you actually are able to engage patients in that way, you can design a system where everybody wins. And there is this kind of reform that's so necessary. So we're really excited to kind of continue to partner with in-person providers and get deeper in some of these core pathways in women's and family health.
It's interesting for a number of reasons. You mentioned payers, and you also mentioned disparities in care and going deeper in communities. And I'll start with the latter subject because it's October, so we're especially seeing a lot of studies around breast cancer and ovarian cancer, and how women of color are affected in greater numbers and die at higher numbers than white counterparts. But there's also access to testing and screening where there are disparities. And that's just breast cancer and ovarian cancer. So how do you think about going into communities where there are already disparities in access?
Well, so this is where digital health, nothing can do this better than a digital health platform partnered with the local communities. So I think, there have been incredible advancements in diagnostics, but the problem is not everyone's receiving them. And to be clear, not digital health alone will not, you need policy for a lot of this as well. But the promise is, and what we even saw during COVID, is that with a virtual care platform that people have in their pocket, even in maternity care deserts, about 35% of U.S. counties today don't even have an OBGYN. You can be that advocate for them. You can be that first source of truth for patients that have that more limited access. And particularly, I think, with a lot of benefits and a lot of, a lot of great progress that is being made that people just maybe can't access. If people had everything in one place, they could figure out where to get that screening, what's covered. There's just so much fear and anxiety in our healthcare system today because you never know if you're going to get hit with a surprise bill. You never know if people are doing it with the right intention and it's really about you and not profit. And so I think that because trust has been breaking down so much, and now, you look at that trust in women's and family health and some of the policies that are even, being put in place today, I think that what we're able to do is capture those patients on our platform, show them that, we have a model where we're trying to make them healthier and we're trying to, improve care, connect with a lot of the different data sources, benefits platforms, give them that virtual access to telemedicine, give them that access to care coaching if they're in higher risk journeys and they need it, and just kind of put everything in one place that makes things that much more convenient and trustworthy.
And then talking about the payer aspect of all of this, you said people are afraid for the surprise bills. I've talked to other female founders in the healthcare space who cite some frustrating conversations with the insurance companies. If they're focused on preventative health, the insurance companies are saying, well, I can't charge as much for that as I could for a cure for something. So there are misaligned incentives. What have your conversations with the payer side of this landscape been?
So we're partnered with a lot of the payers, and I think you can't affect a lot of this change that I'm talking about without working with the system. You have to work with the payers, you have to work with the providers, like or else, you're not going to make the progress that you want to make. And so I think that, as we've partnered with the payers, one of the things that they are excited about with us is the engagement, right? It's the fact that we provide that always on engagement and that comprehensive picture of a patient where it's not just what's happening on a claim, but it's who they are and all of the different things that they're looking for and that their need and their symptoms and, their risk profiles outside of the doctor's office, because not all of that is obviously captured. And so I think that, with maternity, it is an amazing part of healthcare where the payers are also very aligned to reduce C-sections and to reduce time spent in the NICU because that's a cost to them. So there is alignment in women's health on this, specifically in maternity care, that we are partnered with the payers on.
Now, you mentioned the lack of OB-GYNs in certain parts of the country. You said some 35% of the country doesn't have an OBGYN in their region. Is that correct?
Correct. So it could be like a family physician who's delivering babies in a local hospital. And then in situations where there's an emergency, that's when there could be like a helicopter transfer to a hospital with kind of maternal fetal medicine and OBs and whatnot. So I've had personal friends living in some of these towns and hearing some of their harrowing stories. And it's then the population, the statistics kind of speak for themselves.
Well, and then, of course, in the post-Roe environment, we're already starting to see early data from residency programs with fewer doctors or aspiring doctors wanting to match into programs in states with really restrictive policies and laws on the books as a result of that post-Roe environment. How does that legal landscape complicate your own role and Maven's work?
Well, I think there's an urgency for virtual care more and more than ever, right? Because we can be in maternity care desert. So if a patient, only doesn't have an OB in town, or in a lot of cases, a provider who speaks their language, a provider who looks like them, that they trust, that shares their lived experience, that our culturally competent model virtually can complement that. Now, it is certainly not enough. And, I think that as more and more data is coming out of a lot of states with restricted access, there is, not just a healthcare and a clinical urgency to fix this. There's an economic urgency. There's an access urgency. I mean, there's urgency across the board. I think what's very unfortunate and very sad is that there's so many families suffering while we figure out this policy, but currently there's every angle of so many of these policies with restricted access to care are making everything worse across the board.
And of course, we are speaking in an election year. We're 1 month out from the U.S. presidential election. How closely are you watching that? And how much does the outcome of the presidential election affect your work?
Well, I think everybody is watching it closely at the moment. It's hard not to. I think we look at it really, we will partner with whatever administration is empowered to try to make sure that the right women's health policies are getting attention and passed, right? And so whether it's IVF coverage and IVF mandates across a lot of different states so that there's some baseline coverage of IVF, whether, it is kind of how to really have an informed view of why restricted access to healthcare, to women's healthcare in a lot of these different states is also just not the right thing to do. But I mean, every medical association, including state medical boards, are coming out saying this is not good for patients. This will lead to bad outcomes. So I think just ensuring that that all of this data and then coverage too. I think we're making progress on Medicaid coverage, helping moms after they have babies on Medicaid get coverage for up to a year, but we're not fully there yet. And then so there's a lot there. And so we'll partner with whatever administration to make sure that we can support in any way and keep surfacing the data.
Is there a policy you'd want to see from the next administration that would make Maven's work easier, better? Is it Medicare coverage? Is it ensuring more doctors are across the country? Is it all? I'm sure it's all of the above, but is there one specific policy that you'd want to see in the new year?
I think well, first of all, it's not just a policy. I think there needs to be a women's health strategy adopted at large because, to your point, there's not just one thing, right? I think, one thing is there's a dearth of women's health research and funding. And so sometimes when you need to kind of make these policies, you can't make them in the absence of data. And there is a big absence of data in a lot of these areas. So I think continuing to fund that and just women's health in general, as a woman myself, it's kind of crazy sometimes. You go to the doctor and you're like, but what is the right thing? And they're like, oh, it hasn't been studied. Or we don't know, I think absolutely kind of removing some of these restrictions to care in some of these states. It's just really, I think, painful to see needless death and preventable death in maternal health. That is not what that is just is antithetical to, I think, everything anyone in medicine and healthcare believe, but also just as a country. We shouldn't be doing this. So I think there's a lot to unpack there. on the IVF side, ensuring, I think the WHO came out and said 1 out of 6 families suffer from infertility. So there's more and more data there to kind of make the case for these coverage mandates, which is really important. And I think more broadly, just universal pre-K coverage and supporting families in that 0 to 5, to make sure that children by the time they enter school are healthy and they've been supported as much as they possibly can, particularly in more vulnerable populations.
And then pulling back and getting back to the news that we're talking about today, this fundraise, this $1.7 billion valuation, we don't see a ton of female-founded, female-led companies go north of $1 billion, become a unicorn. What does this moment mean for you and for Maven?
Yeah, listen, this is just testament to our team and just a lot of the hard grunt work that we put in over the last 10 years. But there's really just, I think that the next decade, as we think about the next 10 years, right, it's more exciting than ever because, between artificial intelligence and what that's going to do to our care platform and help our patients, and help our providers and our care coaches just take care of our patients better. A lot of the data that's going to surface from that and just to kind of inform the best care pathways, we're really excited about that. And then there's just more urgent need than ever. So I think that, we're very heads down. There's a lot to do. And we're all in on working with the right people to get it all done.
Is there anything else the Forbes audience should know about your plans and what this fresh round of funding will do for Maven and your work?
Well, I think now that we have, more than 2,000 companies covering Maven, look up and see if you have Maven covered in your benefits and sign up. So, but really just thanks so much for having me today.
Kate, thank you so much. We really appreciate your time.
Thanks.